Every 66 seconds, a senior is diagnosed with dementia. By the time you finish this video, that's nearly 20 people. But here's the terrifying twist: it might not just be aging. The real danger could be hiding in your medicine cabinet. You've been told these pills are safe, routine, even essential. Yet research shows certain drugs can shrink key memory centers in the brain by over 28% in less than a year, and 99% of seniors have no idea. Meanwhile, the pharmaceutical industry has known for decades, profiting billions while millions lose their memories. In fact, a 2023 study in neurology and aging research found that one class of medications increased dementia risk by 49% in just 2 years. In this video, we'll reveal the 9 most dangerous medications driving rapid memory loss and dementia, ranked from commonly ignored to mind-destroying. And pay close attention to number 3. It's prescribed to millions for something harmless, yet it can shrink your brain without you even realizing. Before we dive in, drop a comment. What medications are you taking daily? And have you ever felt sudden brain fog or forgetfulness? We're reading every comment and sharing personalized insights. Don't stay silent, this could save your mind. Now let's begin with number 9. And don't let its spot on the list fool you. This one is sitting in almost every senior's cabinet, quietly scrambling the brain before you even notice. Number 9, diphenhydramine, Benadryl. This pink pill is trusted by millions for sleep, allergies, or colds, and it's likely in your nightstand right now. But inside your brain, it disrupts the hippocampus, the region that stores new memories. Benadryl belongs to anticholinergic drugs, which block acetylcholine, a neurotransmitter vital for memory and alertness. As the brain ages, every drop of acetylcholine counts. Blocking it can be devastating. In fact, a 2023 study in the Journal of Geriatric Cognitive Health found seniors using anticholinergics had a 54% higher dementia risk than non-users. How to protect yourself? Avoid diphenhydramine, often hidden in pills labeled PM, nighttime, or allergy relief. For allergies, safer alternatives exist, like loratadine, Claritin, which doesn't cross the blood-brain barrier. Remember, never stop any medication abruptly, but never assume over-the-counter means safe. Up next, a drug marketed as gentle on your stomach, yet it quietly robs your brain of essential nutrients. Number 8, proton pump inhibitors, PPIs. Drugs like Prilosec and Nexium are prescribed for heartburn, GERD, and acid reflux. Many seniors take them for years, sometimes decades. But here's the hidden danger. PPIs block the absorption of vitamin B12, vital for memory, focus, and mood. A 2016 study in JAMA Neurology tracked over 73,000 adults aged 75 plus and found regular PPI users had a 44% higher dementia risk. PPIs also deplete magnesium and calcium, essential for healthy brain signaling. The result? Neurons misfire, causing confusion and memory lapses that mimic early Alzheimer's. Worse, PPIs raise amyloid beta plaques in the brain, proteins directly linked to Alzheimer's disease. What can you do? Ask your doctor about tapering off with H2 blockers like famotidine, Pepcid, which are less harmful to cognition. Natural options, like deglycyrrhizinated licorice, DGL, can also soothe the stomach without damaging the brain. Up next, a bladder medication that may be wrecking not just memory, but also emotional balance. Number 7, bladder control medications. Drugs like oxybutynin, Ditropan, are prescribed for overactive bladder or incontinence. But while they solve bathroom trips, they do so by blocking acetylcholine, the same memory chemical disrupted by Benadryl. Unlike weaker anticholinergics, oxybutynin easily crosses the blood-brain barrier and directly impacts the hippocampus, your memory hub. A 2019 study in BMJ found that adults over 65 who use strong drugs like oxybutynin for more than a year had a 49% higher risk of dementia, nearly 1 in 2. The scary part? Most seniors are never warned. Brain fog, misplaced items, and lost conversations are often dismissed as normal aging, when in reality, the medication is accelerating decline. Safer options exist. Mirabegron, Myrbetriq, works differently, without blocking acetylcholine, and shows far less impact on memory. Up next is a common prescription for nerve pain and mood issues, but it may be quietly rewiring your brain in harmful ways. Number 6. Statins. Statins are among the most prescribed drugs worldwide, especially for adults over 60. Popular ones include simvastatin, Zocor, and atorvastatin, Lipitor, used to lower cholesterol and protect the heart. But here's the problem: cholesterol is critical for the brain. Nearly 60% of the brain is fat, and cholesterol builds the myelin sheath that allows nerve signals to travel smoothly. Lower it too aggressively, and you may starve the brain. A 2023 study in Frontiers in Aging Neuroscience found seniors over 70 on statins for 3+ years had a 26% higher risk of mild cognitive impairment, with high doses linked to even steeper declines. Many patients reported sudden memory lapses, forgetting names, conversations, even familiar routes. Not all statins cross the blood-brain barrier equally. Pravastatin and rosuvastatin are considered less risky. If you've been on statins for years and notice brain fog or confusion, talk to your doctor about dose adjustments or alternatives. Acting early gives you the best chance to protect your memory long-term. Up next, a nerve pain and mood drug that may be quietly rewiring your brain in ways you never expected. Number 5. Benzodiazepines. Drugs like lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are widely prescribed for anxiety and sleep. They boost GABA, the brain's calming chemical, bringing quick relief at first. But over time, they become a trap. A 2022 study in BMJ followed over 8,000 seniors for 6 years and found those using benzodiazepines for more than 3 months had a 51% higher risk of Alzheimer's. The danger was even greater with long-acting drugs like diazepam, which linger in fatty tissues, including the brain. The result? Chemical sedation. The brain slows down, learns less, and becomes prone to confusion, memory gaps, and emotional dullness. Many seniors describe feeling foggy or disconnected. And when they try to quit, withdrawal, anxiety, agitation, insomnia, makes the drug feel essential, when in reality, it's fueling decline. If you've been on a benzo longer than a few weeks, never stop abruptly, it can be dangerous. Instead, taper gradually with your doctor's help. Safer alternatives include buspirone for anxiety or cognitive behavioral therapy for sleep. Up next, an antidepressant prescribed to millions that may quietly rob your brain of sharpness and emotional vitality. Number 4. Amitriptyline, Elavil. Still prescribed for pain, insomnia, and even migraines, amitriptyline may look like a multi-use miracle pill. But beneath the surface, it's one of the most potent anticholinergic drugs, blocking acetylcholine, the chemical essential for memory, focus, and neuron communication. The effects aren't just possible, they're expected with long-term use. A 2015 study in JAMA Internal Medicine tracked over 3,400 adults 65+ and found those with high cumulative doses of anticholinergics like amitriptyline had a 54% greater risk of dementia within 10 years. The tragedy? Most patients were never warned. Many were given amitriptyline for sleep or nerve pain, only to notice creeping issues, short-term memory loss, word-finding struggles, foggy concentration. Even low nightly doses can silently erode brain power, creating drug-induced decline mistaken for normal aging. Safer alternatives exist. For nerve pain, duloxetine or gabapentin. For sleep, melatonin or low-dose doxepin, much milder anticholinergic effect. For mood, newer antidepressants like sertraline or escitalopram, generally safer for the brain. Number 3. Paroxetine, Paxil. Paroxetine is a common SSRI prescribed for depression and anxiety. It's marketed as a modern, gentler antidepressant, but here's the hidden danger: it's the only SSRI with strong anticholinergic effects. That means it interferes with acetylcholine, the neurotransmitter critical for memory and focus, making it far riskier than safer SSRIs like sertraline or escitalopram. A 2021 review in Frontiers in Psychiatry found that seniors on paroxetine showed clear declines in short-term memory, verbal recall, and attention within just 12 months. They were also 30% more likely to show early cognitive impairment compared to users of other antidepressants. A drug meant to stabilize mood can slowly undermine clarity, recall, and emotional balance. The fix is simple but vital: avoid paroxetine in seniors. In fact, the American Geriatric Society has listed it on the official Beers criteria of drugs inappropriate for older adults. Safer alternatives include sertraline or escitalopram, plus natural mood support from B vitamins, B6 and B12. Up next, a drug prescribed for seizures and nerve pain, but its long-term impact on brain connections may shock you. Number 2, antipsychotics. This one is alarming because many seniors don't even realize they're on an antipsychotic. Drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were designed for schizophrenia and bipolar disorder. Yet today, they're often prescribed off-label to elderly patients for sleep problems, agitation, or dementia-related behaviors. The consequences are devastating. A 2022 study in Lancet Healthy Longevity tracked over 25,000 older adults and found seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within 12 months, even without prior dementia. The risks go beyond memory. These drugs raise the chance of stroke, sudden death, and dangerous sedation, leading to falls, hospitalization, or permanent institutionalization. Mechanistically, they suppress dopamine, a chemical critical for motivation, executive function, and memory. With dopamine depleted, seniors often appear dull, flat, or zombified, leaving families mourning the fading personality of someone still alive. The solution starts with tough questions. If you or a loved one is on one of these drugs, ask why, and if it's truly necessary. Often, non-drug strategies, structured routines, reduced noise, better lighting, pain management, and sleep hygiene, work just as well. When medication is unavoidable, lower doses for shorter periods minimize harm. Too often, these drugs are prescribed for convenience, not need, while families are left watching decline they mistake for natural aging, when in truth, it's chemical. Number 1, anticholinergic polypharmacy. This is the hidden danger almost no one talks about, yet it's one of the biggest drivers of drug-induced dementia in seniors. You might expect a single, worst drug to top this list. But in reality, the most dangerous threat isn't one pill. It's the stacking of multiple medications with anticholinergic properties, a situation known as anticholinergic polypharmacy. Picture this: a senior takes diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain. Each alone may cause mild memory problems. But together, they pile up, and the cumulative anticholinergic burden skyrockets. This isn't just theory. In a 2022 study published in Age and Aging, researchers tracked over 280,000 older adults. Those with the highest anticholinergic burden had a 120% higher risk of developing dementia within 10 years, that's more than double the normal risk. And here's the most frightening part: most seniors have no idea they're even on anticholinergic drugs. But when acetylcholine is blocked from multiple angles at once, the brain doesn't just slow down, it begins to decay. Neurons wither, synapses shrink, and the brain enters a hypoactive state that mimics Alzheimer's disease. The good news? This doesn't require a miracle to fix, it requires a medication review. Ask your doctor or pharmacist to evaluate your prescriptions, over-the-counter drugs, and even supplements for their anticholinergic load. There are professional tools that calculate your cumulative risk. Once identified, you can deprescribe, taper off what isn't necessary, switch to safer alternatives, and rebalance brain chemistry. And here's the empowering truth: drug-induced dementia is often reversible. When the burden is lifted, many seniors regain clarity, memory, and energy, sometimes within weeks. The brain is remarkably resilient, if you give it a chance. That's why anticholinergic polypharmacy is the #1 hidden medical threat to the minds of our aging population. Now we want to hear from you. Which of these medications are you taking? Have you noticed brain fog, forgetfulness, or personality changes since starting them? Will you talk to your doctor this week about reviewing your medications? Share your experiences in the comments, we'd love to hear from you. Thanks for watching.